I'd like to welcome everybody to the November 21 meeting for the Pitt County Board of Health. We'll go ahead and call the meeting to order. And up first, we'll hear any public comments. Seeing none, we'll move on to the minutes for the October meeting. Those have been previously circulated. Any corrections or additions from the board? We'll look for a motion to accept the minutes.
So moved.
Second.
Any opposed? All right, the minutes pass. Next, we'll move on to the fiscal report with Marcia Hall.
Hey, good evening, everybody.
Good evening.
I missed y'all last month, a little under the weather. We are looking at the numbers for October, which is period 4. We had one budget amendment, and that was in the amount of $196,800, and that is related to the roof project. The county office moved that over. We do not have a date yet, a confirmed date for that start of that project. We hope we will get that done soon, but we've not had any leaks lately, knock on wood. As you move across this report, our year-to-date is actually looking pretty good. I'm going to contribute that to two main things. The main thing is that the county funding, which we normally get every 3 months, they have already given us half of the approved county funding already. They gave us a quarter in August, a quarter in September. So that number looks extremely large, like we're sitting pretty, but that is the county money that has that's already been given to that line. And if you look up at the clinic area, the top view, we're actually doing okay here. Medicaid transformation really showed up the month of October. We had a lot of bank deposits coming in from the Medicaid transformation companies. We are really trying to stay ahead. It is a lot of work. We did not realize how much of a difference it was going to be in our operation, because we went from just a handful of deposits a month to times 5 the amount we get. So we might get $4 from one of the 5 companies, and that $4 might be spread across 2 or 3 different clinic programs. So we are really trying to figure out operations with that and our banking with our county office. Hopefully we will get us a system down, but it really showed up. And we got to get a plan together. But overall, year-to-date, we have a surplus of the 1.958. Year-to-date adjusted 2.1. So we're sitting okay, and that is due to that county funding. I'm going to move over to our grant report. We're sitting okay there. We have different grants. Some of these grants have not moved, and that is only because the work has not been done and they've had no expenses. Some of the programs have not been able to go into the schools and do a few things, but our Triple P and our HIV PrEP program is still moving. Overall balance of $366,000 at the end of October. Also, our position status. This was as of yesterday. I know that Jennifer was really busy today making some offers. We kind of feel like every offer we make, we take 2 steps back between people chasing other opportunities or retiring. But right now we're sitting at 17 vacancies, and they're in various stages between advertising, re-advertising, background checks and offers. As far as the business department, we have audits. The county is being audited still by Martin and Starnes. That takes up a lot of our time because we're having to pull up past documents. We're also, WIC is being audited by the state program. Audits are not new to us. They just, on top of everything else right now, it is a lot of work. And between Medicaid transformation, we're working with Epic to where the payments will drop in electronically, and so hopefully we'll have that settled out. We've requested lap salary dollars from all of our programs except for the clinic areas to move down to our operating line, so that we may be able to have some room to move some operating expenses around. And that is it, other than the bad debt report. So.
We'll talk about the fiscal report first. Any questions or comments from the board for Marcia? All right, we'll look for a motion to pass the fiscal report.
So move.
Second.
Any opposed? All right, the fiscal report passes, and we'll move on to the bad debt. Marcia?
Okay, so every year our bad debt, so every month I send in accounts receivable to the county office, and Chris McDaniels keeps this running total of our bad debt. And bad debt is, you will see if you get down into the details, which I provided in your email. These are accounts that are, have had for at least 2 years no activity. However, if someone comes back into the health department, this account comes back live, and we will start rebilling them at the newer whatever procedure they get, and we update their address. This is an accreditation requirement, and our state consultants require this every year that we write off this bad debt amount. And we do participate in the debt clearinghouse for the county. We're about 4th or 5th on the list, so like the tax office is going to be first priority, and certain other offices get first priority. But we do get some of these funds back if some of our clients win the lottery or various revenue sources that they may get. But I also put in the different years, the different amounts. The amounts vary greatly. I do expect us to have a larger debt set-off every year, just because now with Epic, we can capture so much more of the procedures that we do, whereas before it was on paper, and Epic can, the billing process is so much different. So this is why we bought Epic, so that we can kind of chase our projects a little and look at them a little bit more in our programs. So, but the total all amount that we needed to write off was the $423,412.28.
And I'm remembering back to last year, the number was significantly smaller.
It was $15,455.
Right. So last year's write-off would have been for 18-19. Is it the trailing 2 years?
It does.
Okay,
correct.
so COVID is big in this number
Yes,
as well.
correct.
So we would expect next year probably to be a similar number.
Could be, yes, sir.
Yeah.
And truthfully, with Epic and now with COVID, I'm not sure what we'll see, because we've only been doing mandated services in our clinics. But, we're capturing every dollar, whereas before we were not capturing but just that on the paper charts. Now, we've got different codes that we can charge each visit. So I'm kind of interested to see how this flows out in the next 5 or 7 years.
Other questions or comments?
But, somebody explained it to me. I felt bad like the first time I asked y'all to write this off a few years ago, but that tells us that we're still doing the work, that the people are getting the services. We may just not be getting paid for it, so we're still doing the work. So,
Other comments? We'll look for a motion to pass the bad debt write-off.
So move.
Second.
Any opposed? All right. Your bad debt is gone,
all
Marcia.
right. Thank you.
We'll move on to any items of old business. None listed. And we'll move on to the new business. We need to look at the 2022 meeting schedule. Betsy sent that out to us. So last we discussed, we're trying to creep back into a somewhat normal schedule as things kind of, I guess, slowly get back to normal with COVID times. Traditionally, we did not have a July or a December meeting. Last year we did. And the proposal here would be to get back to our pre-COVID schedule. No July meeting, our 4 televised, and then no December meeting, official December meeting. Discussion.
Yeah, let's get back to normal.
Everybody happy with that?
Yeah.
Oh, yeah.
All right, we will look for a motion to approve the 22 schedule. Betsy, do I need to just comment on anything else with that? Okay, all right.
So move, sir.
Second.
Any opposed to the schedule? All right, the schedule passes as stands. Next, we've had a request for approval of a child fatality prevention team member. We do have a requirement for a healthcare provider on that. We've had one apply, and then the request is for the appointment of Dr. John Wright to fill this position. I've signed it, which makes it ready to roll. But this is obviously a need for us, and I'm glad Dr. Wright stepped up to do that. So that should all be square. Next, we will move on to the Community Health Needs Assessment with Miss Amy Haddam.
Good evening.
Good evening.
I'm pleased to present to you the 2021-2022 Community Health Needs Assessment. We've been working on that for quite some time, several months now. And joining me tonight is Catherine Nelson. Catherine is a senior administrator with Vidant Community Health Programs, and we've been working together for many, many years and many, many CHNAs, Community Health Needs Assessments. So have a lot to share with you tonight. First, the process of the CHNA and why it's conducted. The document actually gathers and analyzes health data and information that county health departments, hospitals, health systems, and community groups use to help identify and address key health needs and issues in their communities, plan health and disease prevention services, combine efforts to improve the quality and use of population health across eastern North Carolina, and to maintain local control and decision-making about the choice of health priorities and interventions, and to improve health partnerships and communication. So in Pitt County, the CHNA partnership is produced between partnership between the health department and Vidant Medical Center. And as I said before, we have a long history of working together on many CHNAs, working together to do this every 3 to 4 years. For the past 2 CHNA cycles, we've also partnered with Health ENC to produce Pitt County CHNA within a regional framework along with 35 other counties. So this is a new approach for us over the past 2 cycles. The regional approach does allow participating counties to conduct their CHNA in a similar manner by collecting like data within the same time frame. And what this allows us to do is compare that data and then partner when we have like issues across counties. It also allows us to align ourselves for funding. If we want to apply for grants, we stand a better chance of applying for grant funding across the region than we do just within one county. And the CHNA is conducted every 3 years. Local health departments are required to do it every 4 years, but we partner with the hospital who's required to do it every 3 years as an IRS requirement. So we pool our resources and do one document for the county. The partnership with Health ENC, if you've not heard of Health ENC, it is a program of the Foundation for Health Leadership and Innovation, and it's a nonprofit organization focused on improving health in North Carolina. It's guided by representatives from local health departments, hospitals, and community organizations, and works together to identify health issues and concerns across eastern North Carolina, and it includes planning of data collection every 3 to 4 years through the needs assessment process. This is a map of the participating counties. You can see that these are all leaning towards the east for Health ENC. The gold, and actually the green shows that that's health department and hospitals partnering in those counties to conduct one CHNA. The gold is Pender County, and that's only a hospital participant. The gray counties are not included in this initiative. In the western part of the state, they actually have a regional approach, but it's not part of Health ENC. So the health data and information sources. For Pitt County's 21-22 document, primary data was collected through an online community survey, which Catherine's going to share more with you about that later. It represented 35 counties. We also conducted focus groups and other health data provided by the North Carolina Department of Health and Human Services, other national and state data including the U.S. Census, county health rankings, and the Healthy NC 2030 indicators as ranked by regional representatives. So you'll hear more about that later as well. I do have a disclaimer. In past times, I'd say 2 CHNA cycles ago, we mined all the data ourselves. Since we have been affiliated with Healthy NC, they either get a vendor to do that for us. This time they've actually partnered with ECU Department of MPH students and faculty to help gather this data. So it saved us a lot of time. It does require us to go back and analyze the data again to see exactly where they got it from and to make sure we understand it. But we do thank Healthy NC and ECU for this partnership. And we also need you to know that we have added additional data that we thought was important for the needs assessment. So the data findings presentations, over the next few weeks, we will be presenting not only tonight to the Board of Health, but to Pitt Partners for Health, which is affiliated with the hospital, and to the Vidant Medical Center Board of Trustees. Each of these groups will be asked to vote on areas of focus that will comprise a community health improvement plan for the next 3 years based upon the Healthy NC 2030 indicators that will be highlighted in tonight's data findings. This report contains a lot of data that is included for your reference over the next few weeks as you determine Pitt County Health Department's focus for the next 3 years. So the first data that we're going to share with you tonight is demographic data. So total population from 2016 to 19, the population in Pitt County had increased by 2% for an estimated population of 180,742. And just a reminder that population demographics is important because it significantly impacts the community's health profile. Population growth has an influence on the county's current and future needs, and certain population subgroups, including veterans, different ages, gender, race, ethnic groups, have unique needs, and we need to consider that when we are implementing programming and services. Projected population, the projected population growth for Pitt County for 2029 is estimated at 203,250 people. From 2010 to 19, the total population of Pitt County had increased by an overall 8%. Some general population characteristics. Pitt County's population is comprised of more females at 52.9% than males at 47.1%, and approximately 23.5% of males in the county are under the age of 18, which also equals to North Carolina at 23.5% and slightly lower than the counties in the Health ENC region at 23.7%. Approximately 17% of the females in the county are under age 18. That's lower than the state's percentage of 21.3 and lower than the Health ENC region at 22.1. And 25.4% of the county population was over the age of 65 during the last census period. And the median age of Pitt County population is 33 years as compared to North Carolina, which is 39 years. So the population age groups, the 15 to 24 in Pitt County is the most populous age group in Pitt County. In Pitt County, the percent of people between the ages of 15 to 24 was higher at 21.3% than the North Carolina same category at 13.5%, and Healthy NC counties at 14.9%. The remaining age categories are somewhat similar among Pitt County, North Carolina, and Health ENC. Among minority populations, the white population in Pitt County accounts for 57.2% of the total population, while the black or African American population accounts for 34.7% of our population. Pitt County's white population is less than the white population in North Carolina, which in North Carolina is 68.7%, and is also less than that of Healthy NC, which is 64.9%. The black or African American population in Pitt County at 34.7% is higher than the black or African American population in North Carolina, which is 21.4%, and higher than the Healthy NC counties at 30%. The Hispanic or Latino population comprises 6.3% in Pitt County, which is lower than North Carolina's at 9.4% and Healthy NC counties at 9.6%. As far as military population, the percent of military population in Pitt County was 0.2% during the 15 to 19 period. Compared to counties in Health ENC, which is 4.8%, and North Carolina, which was 1.1%, Pitt County had a smaller military population during this period. Veteran population. The veteran population is given as a percent of the civilian population that's aged 18 years and older, and this data is used for policy analysis, development of programs, creating budgets, and for veteran programs and facilities. Pitt County had a veteran population of 7.9% between 15 and 19 compared to 8.4% for North Carolina and 12.1% for the Health ENC counties. Birth rate. Birth rates are an important measures of population health. The birth rate is usually the dominant factor in determining the rate of population growth. Between 2016 and 19, the Pitt County birth rate increased slightly over the period from 11.4 per 1,000 live births to 11.5, and Pitt County's birth rate rose above the state rate in 2008 between 18 and 19, but was still below the Health ENC County birth rate. So next we'll move into socioeconomic data. These factors are well known to be strong determinants of health outcomes. Those with a socioeconomic status are more likely to suffer from chronic conditions such as diabetes, obesity, and cancer. Community health improvement efforts must determine which subpopulations are most in need in order to effectively focus services and interventions. So this is showing you our county's tier of need. The North Carolina Department of Commerce annually ranks the state's 100 counties based on economic well-being and assigns each a tier designation. The 40 most distressed counties are designated as Tier 1. They're the most distressed. The second 40 is Tier 2, and then the 20 least distressed are Tier 3. Pitt County was assigned a Tier 2 designation in 2021. And the designations are calculated based on 4 factors, which is the average unemployment rate, median household income, percentage growth in population, and adjusted property tax per capita. As far as income, median household income reflects the relative affluence and prosperity of an area. Areas with higher median household incomes are likely to have a greater share of educated residents and lower unemployment rates. This figure shows that the median household income in Pitt County was $47,437, which is lower than the median household income in North Carolina at $54,602. Compared to counties in Health ENC region, Pitt County has a high household income. In the region, 21 counties have a lower median household income than Pitt County. Poverty. Federal poverty thresholds are set every year by the Census Bureau and vary by size of family and ages of family members. A high poverty rate is both a cause and consequence of poor economic conditions. Children in poverty are more likely to have physical health problems, behavioral problems, and emotional problems. Seniors who live in poverty are especially vulnerable group due to increased physical limitations, medical needs, and social isolations. And persons with disabilities are more likely to live in poverty compared to the rest of the population. And of course, without adequate income, individuals with disabilities may not be able to afford necessary expenses such as rent, mortgage, utility bills, medical and dental care, and food. As seen in this figure, 23% of population in Pitt County lives below the poverty level, which is higher than the rate of North Carolina at 15% of the population and higher than the Health ENC region at 17.5%. Poverty by race and ethnicity. The most common racial or ethnic group living below the poverty level in Pitt County is Black, followed by white and Hispanic. If a family's total income is less than the family's threshold, then that family and every individual in it is considered to be living in poverty. And this is based on the U.S. Census Bureau. They use a set of money income thresholds that vary by family size and composition to determine who classifies as impoverished. Children in poverty. The percent of children living below the poverty level is higher for Pitt County at 28% when compared with North Carolina at 21%, and the Health ENC counties at 25.5%. Older adults in poverty. The rate of adults age 65 and older living in poverty is slightly higher in Pitt County at 9.7% when compared with North Carolina, which is 9.1%, but lower than the health ENC counties at 10.3%. Disabled people living in poverty. The percent of disabled people living in poverty in Pitt County is 27%, and it's higher than North Carolina, which is 20%. Housing and the median monthly housing cost. The average household size in Pitt County is 2.56 people per household. Those are owners of homes. 2.35 per household for renters, which is just below the North Carolina value of 2.57 people per household for owners and slightly lower for renters, which is 2.43 per household for North Carolina. High cost of ownership with a mortgage constrain both owners and the local housing market. The figure shows a mortgage owner's median monthly household costs. In Pitt County, the median housing cost for homeowners with a mortgage is $1,317, which is just above North Carolina's value of $1,314, but is lower than 6 counties in the eastern North Carolina region. Severe housing problems, and this is based on the county health rankings. From this data comes from those rankings. Safe and affordable housing is an essential component of healthy communities. This figure shows the percent of households with at least one of the following problems: overcrowding, high housing costs, lack of a kitchen, or lack of plumbing facilities. 21% of households in Pitt County have severe housing problems compared to 15% in North Carolina and 16.1% in the health ENC counties. Employment industries in Pitt County. From 2018 to 19, employment in Pitt County grew at a rate of 1.1% from 83.2 thousand employees to 84.1 thousand employees. The most common industries in Pitt County by number of employees are health care and social assistance, educational services, and retail trade. Compared to other counties, Pitt County has an unusually high number of educational services, accommodation and food services, and health care and social assistance industries. Food insecurity. This is based on households with SNAP, or the Supplemental Nutrition Assistance Program. This is a federal assistance program that provides low-income families with electronic benefits transfers that can be used to purchase food. The goal of the program is to increase food security and reduce hunger by increasing access to nutritious foods. And this figure shows the percent of households with children that participate in SNAP in Pitt County and in North Carolina and the eastern counties. So the percent of households with SNAP in Pitt County was 15%, which is higher than the state of 13%, but lower than the health ENC region at 16.7%. Educational attainment. Graduating from high school is an important personal achievement and is essential for an individual's social and economic advancement. Graduation rates can also be an important indicator of the performance of an educational system. Having a bachelor's degree opens up career opportunities in a variety of fields and is often a prerequisite for higher paying jobs. In Pitt County, the percent of residents aged 25 or older with a high school or higher degree was 89.3%, which was higher than the state value of 87.8% and the health ENC region at 86.6%. The percentage with a bachelor's degree or higher in Pitt County was higher at 32.7% compared to North Carolina, which was 31.3%, and the health ENC county region at 22%. High school dropout rate. High school dropouts earn less income than high school and college graduates and are more likely to be unemployed. High school dropouts are generally less healthy and require more medical care. Further, high school dropout rates are linked with heightened criminal activity and incarceration rates influencing a community's economic, social, and civic health. Pitt County's high school dropout rate was 1.4% between 2019 to 20, which was lower than the state rate of 1.5% and equal to the health ENC region at 1.4%. Pitt County's high school dropout rate has been varied over the last 4 measurement periods. High school suspension rate. High school suspension is a form of discipline in which a student is temporarily removed from a classroom and/or school due to a violation of school conduct or code. Higher rates of suspension can be related to high rates of antisocial or delinquent behaviors, which may further contribute to potential future involvement in the juvenile justice system. Overall, Pitt County's rate of high school suspensions have declined. However, between 19 and 20, Pitt County's high school suspension rate was higher, 28.6 per 100 students, than North Carolina's rate at 11.6, and the Health ENC County region at 15.5. Transportation. Public transportation offers mobility, particularly to people without cars. Transit can help bridge the spatial divide between people, jobs, services, and training opportunities. Public transportation also reduces fuel consumption, minimizes air pollution, and relieves traffic congestion. In Pitt County, an estimated 1.3% of workers commuted to work by public transportation compared to the state value of 1% and the Health ENC counties at 0.4%. And approximately 1.2% of Pitt County workers walk to work, which was lower than the state value of 1.8% and lower than the Health ENC counties at 2.9%. An estimated 82.5% of workers 16 and over drive alone to work as compared to 80.9% in both North Carolina and the eastern counties. Crime and safety. Both violent crime and property crime are used as indicators of a community's crime and safety. Violence negatively impacts communities by reducing productivity, decreasing property values, and disrupting social services. Violent crime includes 4 offenses: murder, non-negligent manslaughter, rape, robbery, and aggravated assault. Property crime includes the offenses of burglary, larceny, theft, motor vehicle theft, and arson. Between 2016 and 19, the violent crime rate in Pitt County decreased from 427.8 to 366 per 100,000 population and was lower than the state's rate of 407.7. During this same period, the property crime rate in Pitt County decreased from 3,107.2 to 2,403.9 and was lower than the state rate of 2,501.5 in 2019. Moving on to juvenile crime. Youth who commit a crime may not gain the educational credentials necessary to secure employment and succeed later in life. The juvenile justice system aims to reduce juvenile delinquency through prevention, intervention, and treatment services. The undisciplined rate describes juveniles who are unlawfully absent from school, regularly disobedient, and beyond disciplinary control of the parent, guardian, or regularly found where it is unlawful for juveniles to be or have run away from home for more than 24 hours. The 2017 juvenile undisciplined rate in Pitt County was 0.42. It was lower than the state rate in North Carolina of 1.53 and the Health ENC region of 1.1. And the juvenile delinquent rate for Pitt County of 29.2 in 2020 was higher than North Carolina of 18.8 and Health ENC region at 21.4. Child abuse includes physical, sexual, and emotional abuse. The 2018 child abuse rate in Pitt County of 7.4 per 1,000 population was lower than North Carolina's rate of 8 per 1,000 population and the Health ENC region of 8.8 per 1,000 population. Incarceration. According to the U.S. Census Bureau of Justice, actually not Census Bureau, U.S. Bureau of Justice Statistics, approximately 1 out of 100 adults in the U.S. are in jail or in prison. Conditions in jails and prisons can lead to an increase of infectious diseases such as TB, hepatitis C, as well as assault from other inmates. The incarceration rate in Pitt County has been on a decline over the past 4 measurement periods. However, between 2019 and 20, incarceration rates in Pitt County, which was 366.8 per 100,000 population, was still higher than North Carolina's rate at 304.2 and higher than the Health ENC region at 345.2. Civic and political activity. Exercising the right to vote allows a community to choose elected officials and hold them accountable. Voting ensures that all citizens have the opportunity to voice their opinions on issues such as the use of tax dollars, civil rights, and foreign policy. During the 15 to 19 period, Pitt County had a higher percent of residents of voting age at 78.5% than North Carolina at 77.6%, and the healthy NC counties at 77.1%. Health insurance coverage. Medicaid costs in the United States are very high. Medical costs. People without health insurance may not be able to afford medical treatment or prescription drugs. They're also less likely to get routine checkups and screenings, so if they do become ill, they may not seek treatment until the condition is more advanced or more difficult to treat. The percentage of individuals in Pitt County with health insurance was 88.2%, was higher than the percent of North Carolina at 87.3%, and higher than the Health ENC region at 87%. Nearly 12% of the population in Pitt County is uninsured. This is government health insurance only, which would be Medicaid, Medicare, and TRICARE. This graph shows the percent of population only receiving health insurance through those three means between 2015 and 19. Pitt County had a lower percent of people receiving Medicaid only, which was 13%, as compared to North Carolina at 13.4%, and the Health ENC counties at 15.8%. Pitt County also had a lower percent of individuals receiving Medicare at only 3.8% as compared to North Carolina at 5.5%, and the Health ENC counties at 5%. And then 0.5% of Pitt County residents received TRICARE as compared to 0.4% for North Carolina and 0.6% for the eastern counties. So this next section is going to share with you primary data from our community survey, focus groups, and other data. And I'm going to turn it over to Catherine for this section.
Thank you, Amy.
Thanks.
Yeah, you can click it. Thanks, Amy. I don't know if I can talk as fast as Amy can. That was a lot of numbers, wasn't it? So the interesting thing about doing a community needs assessment, the fun part is getting the opinions of the community, and we do that two ways. We do it through the community opinion survey, and we do it through focus groups. So I'll take my mask off so I don't fog up my glasses. There we go. So in the community survey, there were 25 questions. They were made publicly available online and in paper format. The data was collected from April 1st of 2021 to June 30th of 2021. And the areas examined were quality of life, health behaviors, health perceptions, preventive services, exercise, and access to care. Pitt County had 922 people participate in this survey, and 6 total participated in the Spanish survey. And just a little bit about the demographics of the people that took the survey. 79.5% were women. And 17.4% were men. 60.45% were white Caucasian, and 24.4% were black or African Americans, and 29.9% were Hispanic or Latinx. The age ranges were 32% were ages 35 to 49, 26% were ages 50 to 59, 10.3% were 60 to 64, 9.2% were age 30 to 34, and it kind of goes on down from there. So here are the community survey results for Pitt County. The top quality of life issues were identified in the community survey. 22.6% or 608 participants responded that low income and poverty were a top issue. 13.49%, or 363, responded that drugs and alcohol, including substance abuse, was a top quality of life issue. And then 9.78%, 263, responded lack of affordable housing. So the community survey results, Pitt County, one part it was based on the strongly agree, strongly disagree, and so I will. This slide is kind of busy, but I do want to go through it. I think it's very important that we hear this. So the graph shows how people responded to certain questions or statements regarding how they view issues that support a safe and healthy lifestyle in their county. So there is the statement, there is good health care in my county, 49% agreed, 30% strongly agreed. The county is a good place to raise children, 54% agreed, 22% strongly agreed. The county is a good place to grow old, 48% agreed, 20% strongly agreed, and 21% were neutral. There is plenty of economic opportunity in this county. 41% agreed and 24% were neutral. This county is a safe place to live. 50% agreed, 28% neutral. There is plenty of help for people during times of need in this county. 37% agreed, 30% were neutral, and 17% disagreed. There is affordable housing that meets the needs in this county. 32% were neutral, 28% agreed, and 21% disagreed. There are good parks and recreation facilities in this county. 51% agreed and 22% strongly agreed. It is easy to buy healthy foods in this county. 44% agreed, 20% were neutral, 16% disagreed, and 14% strongly agreed. Another question that we asked this year was about COVID, and the community survey question asked if they had received a COVID vaccine. Between April 1st and June 30th of 2021, 77% of Pitt County participants reported being vaccinated for COVID-19, while 21% had not been vaccinated. So as mentioned earlier, the other method of obtaining feedback from the community were listening sessions or focus groups. The focus groups were conducted in Pitt County due to their historical value of providing information that reflects vulnerable populations who may not be represented in the community survey. It included 8 core questions. 6 were conducted virtually, and 1 was face-to-face in the summer of 2021. So here are the groups that participated in the focus groups. 7 groups that provide health and human services to Pitt County residents or actually participate in these groups. Gold Path Seniors, that's a senior membership program at Vidant Medical Center. Pitt County Aging Coalition, Pitt County Emergency Management, Pitt County School Social Workers, Pitt County School Nurses, the Healthy Lives, Healthy Choices, that's a church lay health advisor program, Pitt Greenville Chamber of Commerce Young Professionals Group, and we had some scheduling conflicts with the Mexican, but hope we can pick that group up before too long. So here are some of the questions. I'm going to go through each one and reveal the common responses to questions asked to focus group participants. In your opinion, what are some of the serious health-related problems in your community? COVID-19, chronic diseases, cost of care, mental health needs, asthma, unhealthy rental homes, and transportation. And they responded that the causes are most likely access to resources, unhealthy lifestyles, bad personal choices, and not getting vaccinated. Question 2, what keeps people in your community from being healthy? Such as challenges or barriers that keep you from being healthy. Getting to appointments, being a working parent or no parental support, children not well supervised, sedentary lifestyle, system distrust, distrust of healthcare providers, food deserts, lack of sidewalks, and too much access to prepared food. The core question 3, in your opinion, what do most people die from in your community? You would expect they would probably say COVID, cancer, heart attacks, lung cancer, diabetes, loneliness, suicide, drug overdose, car crashes, kidney disease, poor lifestyle choices. Core question 4, what could be done to solve these problems? Accessibility to healthy activities, transportation to parks, and more sidewalks. Community awareness of problems and how to address them. Reduce the cost of healthy food, better follow-up by providers after hospital discharge, and address poverty such as social determinants of health. The second part of question 4, what could be done to solve these problems? How can our community be healthier? Food trucks that make healthy food more available, access to safe places to exercise, such as bike lanes and parks, improve collaboration among agencies, and easier access to health care, such as community paramedics, community screenings, and transportation. Core question 5, is there any group not receiving enough health care? Senior citizens, children and adolescents, uninsured, or the low socioeconomic status, homebound, Latinos, blacks. And why? Difficult to access resources. North Carolina did not expand Medicaid. Don't get well visits. Cost of nursing home care, nursing homes, too expensive. Core question 6, how do people in this community get information about health? From direct mail, social media, internet, word of mouth, family, friends, and coworkers, churches, flyers, billboards, and newspapers, and TV and news. Core question 7, what environmental issues exist in your county? Climate change, highways, traffic, rural, spread out, makes it hard to access, flooding, poor air quality, multifamily housing that has allergens, mold, mildew, etc. So here's the $100,000 question. If you had $100,000 to spend on health care, on a health care project in this county, how would you spend it? They like this one. Mobile health clinics, immunization clinics on site at schools, satellite clinics in outlying and hard-to-reach communities, more mental health support and resource access, health coaches, sidewalks, food trucks with healthy food, mobile fresh food stands, transportation to services, and healthy food and activities, Alzheimer's care, and research. Okay, it's back to Amy.
Thank you, Catherine.
Righty. Thanks, Catherine. Yeah, the next data we want to share is that about life expectancy within Pitt County. And the term life expectancy refers to the number of years a person can expect to live. By definition, life expectancy is based on an estimate of the average age that members of a particular population group will be when they die. In the data provided between 15 to 17, the overall average life expectancy in Pitt County was 74.8 years, which was slightly higher than North Carolina, which was 78.1, and higher than the eastern counties at 76.7. Females have longer life expectancy than males in Pitt County and within eastern North Carolina and the state. Whites have a longer life expectancy than African Americans. So the top leading causes of death in Pitt County, and this is nothing new, this has been the same for quite some time. The top 2 leading causes of death in the county are heart disease and cancer. Cerebral vascular diseases and unintentional injuries rank amongst the top 5 causes of death, which indicates chronic disease as an area of concern for Pitt County. This is broken down for year 2019. We generally base our assessments on the top 10 leading causes of death. And as you can see, although Pitt County experienced increases in the rates for heart disease, cancer, stroke, all other unintentional injuries, diabetes, septicemia, chronic liver diseases, and kidney diseases in 2019, Pitt County did rank lower than North Carolina for 6 of the leading causes of death. These include heart disease, cancer, Alzheimer's disease, chronic lower respiratory disease, chronic liver disease, and kidney diseases and disorders. This next graph gives you a picture of how Pitt County has been performing since 2016 with the leading causes of death. Comparing Pitt County's leading causes of death to previous years, the rates of heart disease, cancer, stroke, all other unintentional injuries, diabetes, septicemia, chronic liver disease, and kidney disease all are continuing to increase. This table is a bit busy. I've really put it in here for you to be able to look at later on when these slides are emailed to you. But this table does show the leading causes of mortality in Pitt County and the state, as well as the health ENC counties. The top 2 leading causes of death in all 3 geographies is heart disease and cancer. Unintentional injuries, cerebral vascular diseases rank amongst the top 5 causes of death for all 3 locales, which indicates chronic disease is an area of concern for Pitt County and the state as a whole. Diabetes ranks higher as a leading cause of death in Pitt County than in both North Carolina and the health ENC region, while chronic lower respiratory diseases ranks lower in Pitt County than in the other 2 locales. We have been doing pretty well with diabetes for a while. It stayed at number 7 for a few years, and now it's moved back to number 5. We'd like to see it getting out of the top 10, but so far, recently, that has not happened. This is another very busy table for you to look at later. In Pitt County, when evaluating overall causes of death rates among people's race, ethnicity, and gender, non-Hispanic African Americans experience higher death rates than whites, and males had higher death rates than females. Moving into fetal deaths. A fetal death, also called a stillbirth, is a death of a fetus that is at least 20 weeks gestation but dies before it is born. Fetal deaths affect about 1% of all pregnancies in the United States, but causes of fetal death are poorly understood. The average fetal death rate in Pitt County, based on data from North Carolina State Center for Health Statistics between 14 and 18, was 9.3 deaths per 1,000, which is higher than the 6.9 fetal death rate for North Carolina during the same period. You know, for many years we have focused on infant mortality in our county because we have one of the worst infant mortality rates in the state, and especially in the eastern region. Infant mortality is defined as a death of a live infant prior to his or her first birthday. Pitt County's total infant death rate increased dramatically to 11.5 per 1,000 live births in 2019. The previous year of 2018, the total infant mortality rate was 6.7 per 1,000 live births compared to 8.8 in 2017. Pitt County's 2019 total infant death rate was almost double that of North Carolina's infant death rate of 6.8 per 1,000 live births. There continues to be a significant disparity between white non-Hispanic and African American non-Hispanic infant deaths. This graph is really depicting 5-year averages beginning at 2009 to 2013. So if you see the comparison between the Pitt County white non-Hispanic, and it went up in the mid-years there, but it's started to come back down. But the Pitt County African American non-Hispanic has stayed pretty constant, haven't really made much movement that we would like to have made in that area. Non-Hispanic and African American non-Hispanic was a 4.77 disparity based on 5-year averages. That's a big disparity between the 2 populations. Premature births, low weight births, and birth defects continue to be the leading causes of infant mortality in Pitt County. This is just showing you another comparison. Pitt County is the blue bar, North Carolina is the red bar. This further illustrates the infant mortality disparity This is just showing you how much more disparate Pitt County is compared to North Carolina when it comes to African-American non-Hispanic infant deaths. So next we will share with you, or Catherine will share with you, hospital admissions data from Vidant Medical Center.
Thank you, Amy. So my colleagues at the Vidant Health Business Planning and Strategy Department provided this information to us this past week, and so we wanted to provide this information to you tonight. So in 2020, Vidant Medical Center reported that the top diagnoses among Pitt County patients hospitalized after an emergency department visit were sepsis, unspecified organism, kidney disease with heart failure, COVID-19, hypertensive heart disease with heart failure, and chronic obstructive pulmonary disease. However, in 2021, the top diagnosis of Pitt County patients hospitalized after an ED visit were COVID-19 at 617, sepsis, unspecified organism 420, chronic kidney disease with heart failure 332, hypertensive heart disease with heart failure 201, and other specified sepsis 131. In 2020, Vidant Medical Center reported the top inpatient diagnoses for Pitt County patients. They were single, live-born infant delivered vaginally, 1,309, sepsis, unspecified organism, 664, single live-born infant delivered by cesarean section, 573, chronic kidney disease with heart failure, 464, and COVID-19, 382. As we moved into 2021, the top inpatient diagnoses for patients living in Pitt County were single live-born infant delivered vaginally, 943, COVID-19, 608, single live-born infant delivered by cesarean, 495, sepsis, unspecified organism, 421, and chronic kidney disease with heart failure, 366. So data from the North Carolina Department of Health and Human Services reports from 2016 to 2019 in Pitt County identified the leading causes of injury deaths was unintentional poisoning. The leading cause of injury hospitalization and the leading cause of injury emergency department visits were unintentional falls. Okay, we'll turn it back over to Amy.
Okay, moving into communicable diseases, as you can see, these are the top 10 communicable diseases in Pitt County, reportable diseases. Preventing and controlling the spread of these diseases are a top concern among communities. These top diseases, as reported by NCDHS in Pitt County in 2018, are represented by this graph. Chlamydia ranked highest among percent of cases reported. It is a common STD that can infect both men and women. It can cause serious permanent damage to a woman's reproductive system. Chlamydia has been so high in Pitt County, I mean, we are about 80 to 90% higher than the state when it comes to chlamydia rates, and this is an area that we selected, or y'all selected, during our last needs assessment for us to focus on. So there'll be more information in your slides about chlamydia and where we are once you receive those. So access to health care in Pitt County. This very busy slide here, this represents access to care in the county. Access to primary care is necessary to improving the health outcomes of a community. With the recent spread of COVID-19 in North Carolina, primary care is critical as an entry point to further care. Many rural areas of North Carolina lack adequate access to primary care providers. The disparities in access between rural and metropolitan areas have continued to grow despite an overall increase in physicians in North Carolina. So on this map above, the green indicates that Pitt County is meeting the North Carolina Institute of Medicine's target ratio of one primary care provider to every 1,500 people. Currently, 60% of North Carolina's 100 counties meet the Institute of Medicine's target. There were 7 counties that were substantially below the target. And the Institute of Medicine's definition of primary care clinician includes physicians, nurse practitioners, physician assistants, and certified nurse midwives. So this next graph depicts the number of physicians in Pitt County. The number of physicians per 10,000 population in Pitt County increased from 40.6 in the year 2000 to 50.4 in 2019. Okay, next I want to share with you, I've mentioned earlier about the Healthy NC 2030 community indicators that between the NCDHS and the Institute of Medicine, there are 21 indicators, I believe, 21 indicators that we really need to be modeling our interventions around. And in 2019, there were several community listening sessions that centered around the 2030 objectives or indicators. So the 2030, Healthy NC 2030, the focus shifted from individual health topics to a population health framework. We've really moved to indicators rather than just saying we're going to focus on cancer or we're just going to focus on heart disease. There are distinct indicators that they're asking us to base our interventions on, which I'm going to share with you in just a moment. The current focus with the Healthy NC 2030 is on health equity and overall drivers of health outcomes. So here are the results from these listening sessions for the Greenville and Eastern area. So the first category is social and economic factors. During the sessions that were held, and this one was actually held on February 27th of 2019 at Eastern AHEC, and there was 117 participants that represented 29 counties across Eastern North Carolina. Out of those listening sessions, and I actually participated in this one as well, and I think Catherine did too, the 4 major topic areas that were selected as areas of focus were social and economic factors, health behaviors, physical environment factors, and clinical care factors. Participants were then asked to rank the importance of factors within each topic for their communities. And as shown above, among the social and economic factors, the East ranked incarceration rates, short-term suspension rate, and residential segregation as high importance. The next area was the physical environment. We were also asked to also rank these areas as shown above among physical environment factors. The East ranked blood lead levels, and air pollution, and access to exercise opportunities, all as indicators of high importance. The next area was health behaviors. As shown above, among health behavior factors, the East ranked deaths due to falls, HIV diagnosis, breastfeeding, and excessive drinking as indicators of high importance. The clinical care area, the East ranked vaccinations, school nurse ratio, routine checkups, and heart disease mortality as indicators of high importance. We also use the county health ranking indicators to help drive our work and our interventions. So the county health rankings are based on a model of community health that emphasizes the many factors that influence how long and how well we live. The rankings use more than 30 measures that help communities understand how healthy their residents are today, which is the health outcomes, and what will impact their health in the future, the health factors. So this is the model, the framework. This figure represents health indicator recommendations for Pitt County that were provided by the most recent county health rankings. Indicators highlighted in yellow are recommendations to explore for improvement, and indicators highlighted in green are areas for strength in Pitt County. So summary and considerations. There are some limitations. The data presented represents a snapshot, a very quick snapshot of the population, economic, and leading health and wellness issues in eastern North Carolina communities. It also includes the primary data gathered from the community surveys, as Catherine shared with you, and we did focus groups in Pitt County. I don't know if any other counties also did focus groups, but we felt like they were very important because we get very valuable feedback from the individuals who work in groups that serve and provide health and human services to these individuals in our county. This information presented tonight can be used as a guide for helping communities identify leading health issues in the healthy NC County region. And other health issues, data, and resources may be available, but were not listed here that our community might consider addressing or establishing as a health priority. So if there's something that we have not presented tonight that you think, why did you not present that? That's something we can discuss at another meeting. So the Community Health Improvement Plan, after we develop the Community Health Needs Assessment document and have selected health priorities on which we will focus, this time it will be on indicators, we do have to have a plan, and it will be based around those 2030 indicators. So because many health concerns involve many risk factors that increases a person's chances of developing a disease or contribute to a health problem, it can be complex. You know, we can't focus on everything at one time, but we do need to have a start and decide what it is we need to put most of our efforts into. Setting public health priorities and developing a community improvement plan to address health issues is critical to achieve wellness, and it requires collaboration among many partners and stakeholders. And identifying key community health issues and determining needs may differ by each community and available resources. They actually may differ a bit within our community because we will present this information to Pitt Partners for Health, which is administrated through the hospital, and there are many community members that also participate within that group. And that group will determine the health priorities that they want to focus on in December. This will be presented to them November the 18th, and then in December they will decide what they want to focus on. We'll bring that information back to you at your December or January meeting to let you know what was selected there. And very often there's a crossover, there's an overlap. But then many times you may choose as a board to focus on something in addition to what Pitt Partners Vidant Medical Center has decided to focus on. The beauty of this, so it's being in a partnership, several of our staff serve on Pitt Partners, and you know, we have a collaborative work relationship back and forth, so we are, you know, covering more territory with more staff and being able to focus through two different entities. So consideration for health indicators. As part of the Healthy People 2030, the CDC leading national indicators are measurable objectives associated with targeted evidence-based interventions. Healthy NC communities may consider the following when developing their plans. We do need to focus on upstream measures such as risk factors and behaviors rather than disease outcomes. That's a new way of thinking, the results-based accountability way of thinking. I've had to get used to it myself because for over 30 years I've had a different way of thinking. We also need to address high priority public health issues that have a major impact on public health outcomes. Those that are modifiable in the short term through evidence-based interventions and strategies to motivate action. Those that address the social determinants of health, health disparities and health equity, and includes monitoring data, preferably annually. So for your convenience, I have broken out the categories of the health indicators. So this slide is social and economic factors, and this is what that means, such as poverty level, unemployment, short-term suspension for students, incarceration rate, adverse childhood experiences, and third grade reading level proficiency, and then the desired result. The next category that is recommended by 2030, the physical environment category, which would be exercise opportunities, healthy food, housing, and the desired result for each of those. The next category is health, That one actually was physical environment, excuse me. This one is health behaviors category, which would be drug overdose, tobacco use, excessive drinking, sugar-sweetened beverage consumption, HIV diagnosis, and teen birth rate. And then the clinical care category, those that are uninsured, the ratio of primary care physicians, early prenatal care, suicide rate. And then the health outcomes category, which they classify infant mortality and life expectancy. So that concludes the categories for the 2030 health indicators that we would like for you to look at. There's also the entire document is online. I'll send you the link to that as well, but this is the 2030 indicators. And each one of those that I share with you has great reading about why those indicators were selected. I'll share that with you as well. So the next steps for the Board of Health. We'll email you these slides so that you'll have them to look through when you're helping to think about what we should be focusing on for the next 3 years. As I said before, we do encourage you to review the full online Healthy NC 2030 report, which is published by the Institute of Medicine and DHHS, both North Carolina. And then based on that information and the presentation tonight, we'll be asking you to select indicators of focus for the next 3 years during either your December or January or either both meetings. And then the final CHNA document will be completed and submitted to the state by March 1st. And then after that, we will develop an improvement plan based on your selections. In the slides that you will receive are the references here so that you can easily go back to see where the data was obtained. And there's several of these. I said the majority of this was compiled by Health ENC, ECU. Another one. And that actually concludes our data presentation. Very, very quickly, a lot to delve into when you get a moment.
Thank you, Amy. A lot to unpack there. We had this down as an action item, but we're not taking action tonight, right?
We have in the past taken action to approve the report.
Yes, okay, we'll do that, and then we'll circle back to in our next meeting. All right, that was a lot of information.
Yep.
Questions for Amy, comments on the report before we take a vote? Kelly?
Yeah, I do have I hope it's a quick question. So the indicators that are being proposed for this coming 3-year period, how does that compare to the previous plan and indicators? And I heard you say that we're doing indicators now versus health topics previously, but is there any overlap with that?
Yes, there is some overlap. And for example, chronic disease is included in there. It's just not spelled out as chronic disease. I can give you some examples of that when I send you information about how we might be able to include, like, life expectancy. If we find that we want to focus on diabetes or cancer, definitely that's going to increase life expectancy if we're addressing those chronic diseases. So there is a way to address them. We just have to look at it differently, if that makes sense.
It does. Thank you.
Dr. Garrison?
So first, this is an incredible amount of work, and y'all should be commended and congratulated and thanked for getting it done and bringing it and pass it on to all the people, because I know y'all were leading it, but it was lots of others that were involved in helping get it done. I think if we were in ordinary times, we would look at this and say, okay, that looks great and sounds great, but we're not in ordinary times. And a lot of the data that you presented was ended in 2019. And that's not unusual. I mean, it's typical to take a year or two to get data, and it's typically you're a year or two behind. But and I appreciate Catherine showing the hospital admission data and how it changed and how it became COVID. But the world has been upended. One example would be car crashes. I mean, in 2020, the number of vehicle miles traveled went down, but the number of deaths in North Carolina went up significantly, especially if you do it on deaths per vehicle miles traveled. But I'm wondering if there should be some big asterisk or paragraph or something that sort of comments that we use the data that we have. We have some 2020 data, some 2021 data, but please, you know, we need to take all of this change in the world into consideration. And, you know, communicable diseases didn't even have COVID on there.
Right.
And so I'm just wondering if there should be some sort of modifier or comment or something like that. I don't know exactly how to do it.
I feel like other counties are probably running into the same thing. It does give us the opportunity to select in addition to the indicators they've presented to us, or it may be that within the indicators, you know, COVID or you know, whatever it should.
And I don't think it has to be COVID-centric, but I think we do need to note the world's changed and we're doing things differently, and we may for a while and things like that.
Yeah, I agree, and with looking at this data for the past several weeks, because normally we mine the data ourselves, but since we've had help doing it, you still have to go back to understand it. And I was very surprised, even with mental health, I didn't see that coming out as much as I think we will a year from now. And I was in that same mindset, wonder what this would look like if we had waited another year. Unfortunately, you know, we're held by the IRS time frame as well as our state accreditation time frame, which usually is a little bit, you know, have more grace with that. But I think we probably could come back in a year from now, and if we wanted to modify some of what we're doing, we probably
Like an
could.
addendum or something, yeah.
And then we also have an annual State of the County Health Report too, that is going to bring out more information a year from now that we'll be sharing.
Thanks.
Amy, I just wanted to reinforce that, because I was having the same thoughts as you went through that. I mean, I think that, because I know this is used for resources, and as we think about resources, I think it's impossible to not think about what COVID has done to personal resources, community resources, and all that. So I don't know, again, I don't have a solution, but I do think that we're in a unique period right now.
Yeah, I agree. And I think as a board, you know, you can certainly decide what Pitt County Public Health needs to focus on and how you want us to do that.
Commissioner Albright?
Yeah, I just wondered if this would be an opportunity to go forward to the county with some requests for fundings. If you know, at the next meeting, if we identified certain areas that required some cash, you know, with the COVID money that's coming in, and possibly updating this report would give you some extra strength for that, if it's possible to be done.
Yes, once you select the areas of focus, then
One thing that shows up, it seems like in several places, and as certainly a very detailed and impressive report that will take a while to digest, is the different ways that transportation shows up. And I tell you, it's a really tough call in this county. There's an awful lot of traffic on the roads, and there are a lot of buses that pass each other. You know, if this group and combined with Vidant were to get behind something, I don't want to belabor this, but you know, I was involved with some discussions with the city to try to revitalize what was in the late 90s an attempt to create a county-wide public transportation system, which, you know, we possibly could get people to the Alice Keene Center, and we could do a lot with activities like that. That fell apart, and I understand some of the reasons for that now, but there was an interest in the city, and certainly from Pitt Community College, and we were at the point of trying to bring in Vidant to that discussion when COVID hit, and all of that fell apart. So I don't know how that would get jump-started, but, you know, something that's forceful from a body like this this would be very, I think would go a long ways towards people, at least addressing the I think there are 5 bus systems that operate in this county right now, and none of them interact with each other. Anyway, excuse me.
Other comments or questions? All right, if not, we'll look for a motion to accept the community health needs assessment presented this evening.
So moved.
Second.
Any opposed? All right, it is accepted. Thank you, Amy. Thank you, Catherine. Next, we'll move on to the Health Director report, Dr. Silvernail.
Good evening,
Good evening.
Mr. Chairman, Dr. Chairman, good evening, Board. Thank you, Amy, thank you, Catherine. Great report, a lot to digest in there. I'm going to try to be brief, given the hour and the length of the meeting, but do have to give you some information regarding things here. Just talk about everybody's favorite subject, COVID. This graph you've seen, again, I like to show this. The state actually put out a press release a couple of weeks ago, sort of based on this graph that said, hey, look at what vaccination has done in the long-term care population. The orange or salmon color in the graph are those individuals who live in group homes or long-term care facilities. And if you remember last year, we're about a year now already into the vaccine era for COVID. Vaccines started about the middle of December. First boosters we considered the second dose of the primary series was given by mid-January. And you can see that the orange just falls off of the curve. There's almost no orange on that curve until we get to the Delta wave here at the far right end. And most of those cases in long-term care facilities were unvaccinated folks at that point. So great curve. I think it speaks to the effectiveness of the vaccine, especially in that population. That's an older, medically frail population in general, and really just says, hey, the vaccine works. This is our curve by race and ethnicity. I think there's 2 things here that are interesting. If you look at the ECU spike of last summer, you see the teal color or maybe mint green color there represents those who identify as other. And when you look at the Delta wave, we also see a number of those that identify as other, not our typical demographics as white, black, Hispanic, showing that I believe our younger folks more often see themselves as multiracial or polyracial individuals. I think there's some good news in this too, that while African Americans were a little bit late in peaking in the Delta wave, they've actually dropped off. And when you see this week's curve, which unfortunately I had to make these slides up and couldn't put in this week's curve, they have about half the cases in the African American population as last week. Sometimes I think it's helpful to look at this on a week-to-week basis. This is by age, and I think the group that we've been most concerned about is our school-age kids. And you can see at the height of the January wave, we're at about 200 cases a week. Here we were about at 400 cases a week. Again, that has fallen off dramatically in our school-age kids, as it has in all age groups. Our young, healthy working population, this 25 to 49-year-old group, the red bars, have borne the brunt of the disease in Pitt County throughout the epidemic. And interestingly, when you look at this, and I didn't show this to you graphically, but when you look at the distribution of vaccines, the group that has the lowest vaccine uptake is the 25 to 49-year-old group. So again, I think pointing out the effectiveness of the vaccines in our population. This often concerned about testing availability in the county, and if we look back to the January peak, we did just shy of 10,000 tests. And again, we were well up into the 8,000, maybe pushing 9,000 tests at the peak of the Delta wave. Good news is that our percent positivity was down around 5 when this chart was made. It's actually, as of today, about 4.8 over the last 7 days as a rolling average. So it has come down significantly. This is kind of the little data dashboard or data report card I run every day. Over the last 14 days, we've had 340 cases. It's about 24.3 cases a day. If you look at that on a cases per 1,000 basis, it's 1.8. CDC wants to look at it as cases per 100,000 in a county that's less than 200,000. I'm not sure how illustrative that is. I also think it's harder for our residents to understand. But if you multiply that out, that's 180 per 100,000. So we're still considered a high transmission county using the CDC definition of 100 cases per 100,000. Although if you think about that, you know, 2 people in 1,000, you'd have to be pretty unlucky to run across those 2 people in a given day, or even in a 2-week period maybe. So
John,
maybe that definition needs some
so
tweaking.
it's 100 per 100,000 to get into the high category. If you go below that, you're moderate. Is that
Yeah.
right? So we're close.
Well, it's substantial and then moderate, Dr. Garrison. So
Okay.
and low. There's 4 categories. Percentage, we know right now that about 16% of the county has tested positive at some point for COVID-19. As of the 8th, we would estimate that 98.4% of the cases in Pitt County have recovered. Again, I think that's some good news. We've only incurred 143 fatalities. Not to belittle that or to say that that's a small number or an insignificant number, but in comparing our case fatality rate, our raw number of fatalities to other counties, many counties that are even smaller than Pitt County, we've incurred less fatalities than other counties have. So we have fared fairly well there. Our case fatality rate unadjusted is at 0.5. We know that at least for the Alpha variant, there are about 2.5 cases out there for every case we could count. So using that conversion, we would have 74,775 cases in the county, and that would take our case fatality rate to 0.2. If we looked at Delta, we may be somewhere between 4 to 6 to even 7 cases for every case that we had. So that would add an additional number of cases to that, which would make that case fatality rate even lower. Vaccinations, COVID-19 vaccinations for adults 18 and over. It's widely available across multiple providers in Pitt County. The health department has served as the Moderna hub, and it's currently providing first, second, third, and booster doses. The booster doses have a little bit of a rub for the Moderna, where the first 2 doses are 100 micrograms per dose. The booster dose for Moderna is 50 micrograms, so it's a half of the first dose. For those with immunocompromised receiving a 3rd dose, they get the full dose as in the first 2 vaccines. To date, we've given more than 13,000 doses of the Moderna vaccine, and I stress with nothing more than the typical side effects we would expect with any vaccination: soreness at the injection site, redness, swelling at the injection site, mild systemic illness, so not feeling well, maybe feeling like you had COVID for usually 24 to 48 hours. Rarely does it last more than 2 days in folks. So I feel, again, that's a testament to the safety of the vaccines and the tolerability of the Moderna vaccine. Big news in the past week, the approval under emergency use authorization of the Pfizer-BioNTech vaccine for ages 5 to 11 years. It had previously, when the Pfizer vaccine hit the market last December, it was 16 and over. The age was then lowered to 12 and older. This is a different formulation, different dosing, a different product. It has a different buffer in it compared to the 12 and older vaccine, but it has been approved for emergency use for ages 5 to 11. We're in the process of training our staff and contract nurses. We have run our vaccine program largely with contract nursing staff. So Dr. Hardy did an in-service this morning for them. We're going to do our first clinic tomorrow, very softly scheduled clinic, and then with a larger clinic later in the week, and then we'll have a regularly scheduled clinic every week. To minimize the risk of medication errors, because the dosing of the pediatric vaccine, Pfizer vaccine, is so different from other vaccines, we're going to do that as a dedicated clinic, dedicated time, hours on certain days of the week. And the details of all of that will go out in a press release once that is set up. The vaccine, we're not the only site in the county. This is available through the federal pharmacy program, so we don't know which pharmacies in the county have it yet, but we know that it is going to the pharmacies. It was going to pediatrician's office. I'm assuming that Vidant received some as well. This is across the spectrum here, much more widely available than it would have been had it come out last December, where we had very restrictive providers available to give the vaccine. So as of yesterday, individuals with at least one dose in the county, 94,186. That's 52% of our county population. Fully vaccinated individuals, this does not include third or booster doses in that data, 88,358, or 49% of the county fully vaccinated. So reasonable numbers, could be better obviously, but reasonable numbers. We continue to creep up in those numbers, but uptake remains slow for the vaccine. We have begun giving flu vaccine to the community as well. I know in general, in the past it's been offered to the Board of Health. When we've done our November meeting, or our October meeting with COVID, we're a little behind the flu vaccine schedule this year. But if you haven't had your flu vaccine, you're certainly welcome to come to the health department for a flu vaccine. I want to talk to you about a regional grant that we are potentially going to receive. This is tied to the state budget, which is still present in limbo. This is the regional workforce grant. This is state ARPA dollars that are going to be handed down to each region. Pitt County Health Department serves generally as the lead on these regional grants for Region 10. The grant guidance is still developing. Each region must hire a regional workforce development coordinator, and then that individual will have to develop a public health staffing plan, a regional training plan, and ensure a plan to ensure diversity in hiring of public health workforce individuals. The grant, as I said, is tied to the approval of the state budget, so right now we have no date of when this will be available to us because the budget remains in limbo at the moment. The potential dollar value of the grant is a little in excess of $1.7 million. And it's also a short timeline. It'll be for the next budget year with the state. The unnamed project, not to be funny, this is something Dr. Lamson and I have been working on. This started out with a request from me to develop an integrated care program in our clinic where we could integrate some behavioral health services into the services that we offer. Dr. Lamson was kind enough to come meet with myself and my leadership team, and then came back and did some listening session with our nursing supervisors and some of our clinical staff to assess the needs that we have for behavioral health services in our clinic. Angela then went out and wrote a HRSA grant to provide funding for that project. The grant was well scored, but was not funded. So it's kind of left us without funding. I did not realize that when she wrote the grant, not only was she planning to provide services at Pitt County Health Department, she was looking to work with the school system and some other entities as well. So what we are looking to do is develop a series of what, at least for now, I'm calling professional service centers around the county to help meet the needs of Pitt County residents. Potential services available through these sites would be direct medical care, behavioral health services, WIC and nutrition services. Dr. Lamson's very keen on creating a trauma-informed community, so that would be available through these centers. potentially providing OT, PT, speech services at these centers, and also allowing our social services colleagues to be there to process applications and those sorts of things for individuals. Potential startup funding for this could come from county ARPA funds. There's also money headed towards Pitt County through the opioid settlement. We continue to look for other grants, and there's also the potential for some philanthropic funds. Ultimately, the goal is to have this program be mostly self-supportive by being able to bill Medicaid, Medicare, other private insurance that individuals might have who would come to these centers. This, I think, ties into the workforce development across many potential disciplines. We could use interns to help staff these, both as an inexpensive workforce, but also as a learning experience and part of their training. Obviously, they would need supervision, but with appropriate supervision, these could be great learning environments for individuals across many disciplines. Some of these sites could be located in a Pitt County school facility to serve students, faculty, and staff at the site, as well as the community it serves. Dr. Lenker originally approached me about school-based health clinics in the fall of 2019, and I said, hey, let's take a look at that. And then COVID came and obviously didn't even push it to the back burner, it put it in the fridge. And he is still interested in having those clinics. Dr. Lamson and I met with him and one of his assistant superintendents about the project. He is certainly interested in supporting the project. So just wanted to kind of give you a quick brief on that. I think this could be a great thing for the county and a way to get the services to the people. As you see in that community health needs assessment, transportation and getting to services is often very difficult for folks in the county. If we can take some of those services out to various points in the county and put it closer to the folks who need it, we may be able to take a bite out of some of those issues. And that is my last slide. Happy to take any questions from you.
Anything from the board? Questions or comments for Dr. Silver now?
What exactly is a trauma-informed community?
Well, you've heard the expression ACEs, this adverse childhood experiences. Part of that is teaching people to recognize those situations and also to avoid them, and that things that are inadvertently traumatizing folks and traumatizing children. And then there's adult trauma as well. So we want to recognize that the traumas that we all experience affect us in varying ways.
In your discussion about the unnamed project and the sites, what sites were recommended or discussed other than the school system?
In terms of
Location.
we've looked at, if you think of Pitt County as kind of like a diamond, we look at having something out in the Farmville area, sort of that western Farmville Fountain area, something up in the northern tip, up in the Bethel area, something out in the eastern tip in the Grimesland area, potentially, something down in the Ayden-Grifton area, and then the health department would serve as sort of a central site for the center of the county. And
my question,
other sites could be developed as well.
let me rephrase. Not using the school systems, not using the actual space for the different schools.
Oh, you mean the actual physical
Yes.
space?
What outside of those has been discussed? If
Nothing,
anything?
nothing yet. So it would be either finding a building that could be renovated and used for that purpose. You may even look at having to build something for that purpose, depending on what you wanted to have there. It would be nice to use the schools in some of these places because that real estate already exists and is already county owned.
Would this take place during school hours?
Yeah.
So obviously for the students, I get that, but for people in the community not affiliated with the school, my question comes to vetting the people that are going to be in the school building
Yeah,
with the students while they're there.
Yeah, they would not be allowed to just wander through the school.
Sure.
There would be a separate entrance and security and all those things that go with it, Dr. Harrell. It wouldn't be that you would go to the school, wander through the school to get to the
Yeah, I
clinic. There would,
I understand.
it would be set up in a manner that would limit access to that facility with appropriate security and safeguards for the students in
That was
school.
my point I was getting at. Thank you. Other questions or comments for Dr. Silver now?
Real quick.
Yep.
Dr. Silva, now, who else are you working with on that grant? I think you mentioned it, but I
This
don't
is,
recall.
Dr. Lamson had written this for the project originally. So right now it is the Health Department, Dr. Lamson and her program, Pitt County Schools. At some point, Biden will get a piece of this as well. I've spoke with, I was gonna say Chancellor Mitchelson, but Assistant Vice Chancellor Mitchelson about this. Ron is very supportive of the idea from, his position as the Associate Vice Chancellor for Health Sciences now, with ECU having a piece of this as well. So I see sort of the big 3 or 4 entities in the county helping to sponsor this, and then billables to be able to generate billables out of it. The question organizationally is, how do you control something like this? Would it have its own board? I don't know if we would want to take responsibility for it. I don't know that Dr. Lamson and her program will want to have sole responsibility for it. I think there would need to be some sort of community-based board tied to the county, obviously, since some of these sites would be county-owned real estate, to help manage this. But it would be sort of like a physician services agreement or a provider services agreement where the site would be there, and we would contract with someone to put a provider there and share the revenue from that. It's a little vague, and I don't mean to, I'm not being
It's okay.
intentionally vague, it's just it's in its kind of its infancy right now.
Yeah, I look forward to how that develops as you start to work with community partners, because the same concept I'm hearing in a lot of different spaces. And so it's going to be important for these folks to work together.
Yeah.
Otherwise, we're going to be stepping on each other's toes, trying
Yeah.
to get it all done.
Yeah, there's a model for this that's been used in Louisville, Kentucky, that's seems to be fairly successful with this idea of these community centers.
Yeah.
They have a name that is trademarked, so we can't use the same name that they have. But they've done something very similar to this.
Good stuff, thank you.
You're welcome.
Anything else? Thank you, Dr. Silver now.
You're welcome. Thank you all.
All right. We'll look for a motion to adjourn the meeting if we don't have any other comments or questions or discussion.
So moved.
Any opposed? All right, the meeting is adjourned. Thank you all so much for your time.